Economists and business leaders recently penned a letter to Congress pushing them to include healthcare price transparency in the next stimulus package. And joining us today to discuss this issue and what it means for Americans is one of those economists and former White House special assistant to the president at the National Economic Council, Blase. Brian, thank you so much for joining us. My first question to you is, how exactly would system-wide price transparency save Americans money and actually stimulate the economy?
Hey, Alex, thanks so much for having me on. It's estimated that waste and unnecessary services cost Americans nearly $1 trillion every year. And every dollar that Americans spend on healthcare services that don't provide them value is one less dollar that they have for other things that they need and want. Price transparency is aimed at helping consumers be better shoppers and better navigate the healthcare system so that they can find lower priced, high quality providers. Let me give you one example. There's a center in Oklahoma City that provides transparent prices, and people from around the country go there because they provide upfront price information. It's not this endless stream of bills that are frustrating and complex for people after the fact. There was a Georgia woman who needed an orthopedic procedure, and she went to her local hospital and she was quoted a $40,000 price. She called the Surgery Center of Oklahoma and they gave her a price quote of $4,000, a 90% savings. She then called her local hospital in Georgia and they matched the price. They agreed to do it for $4,000. The key was the transparent price information that introduced competition into the market and that forced the high price provider to lower their prices so that they wouldn't lose a customer.
Wow, 90% difference. That's incredible. So is there any update on this legislation that was recently introduced?
So 90% of Americans believe that hospitals and insurance companies should provide upfront price information. The Trump administration has acted, put forward bold rules that require hospitals and insurers to provide upfront price information. And now Congress, there's a bill in the House and a bill in the Senate, are taking steps to solidify, to make permanent those actions so that people have upfront price information. One of the leading co-sponsors of the legislation is the powerful chairman of the Senate Finance Committee, Charles Grassley from Oklahoma. So there are growing numbers of co-sponsors on that legislation. Now it's an uphill climb. There's powerful special interest groups that benefit from keeping American patients and employers in the dark. They're benefiting from the status quo.
So will this benefit businesses as well as consumers?
Yeah, businesses provide health insurance for nearly half of all Americans. That's 160 million people. Yet when businesses shop for coverage and for care, they're doing so blind, relying on an insurance company that often doesn't have the same incentives that they have. The business wants low cost. Insurance companies often receive profits based on a percentage of total spending. So they have an incentive for prices and spending to grow over time. What transparent price information allows businesses to do is monitor the insurers, make sure that they're getting value, and also help design creative benefit structures so that their employees are using high value, low cost providers. Ultimately, every dollar that businesses save from lower healthcare expenses is another dollar that they can use to hire workers or expand their workforce.
Well, it's certainly important to be informed, to know every angle of the conversation. Brian Blase, thank you so much for your time today.
Thanks for having me on.